As COVID-19 cases rise, that means the pandemic is sticking around with an uncertain end date.
And many who have already gotten the virus say their symptoms aren't going anywhere either. Madeline O'Neill shares what some call the shadow pandemic.
Well, recovering from COVID-19 can be just the start of the battle for many. A local doctor tells me as many as 40% of people with COVID-19 may end up with one of many potential long-haul symptoms.
Well, I think the biggest surprise to us was the duration of symptoms. Sometimes it takes months before people will feel that they're back to their normal self, and sometimes not even by then.
UW Health's Dr. Nasia Safdar points to long-haul symptoms including cough and shortness of breath, but also ongoing neurological issues such as brain fog and fatigue, frustrating for more than one reason.
One is you don't quite know when the symptoms will improve, and the other is there's not a single therapy or group of therapies that are specifically targeted for long haul.
We need to fast track science on this.
After getting COVID at the start of the pandemic, Diana Barrett of Maryland founded Survivor Corps, a nonprofit with a Facebook community with members all over.
There are 175,000 people strong, I believe, at this point, and sadly growing.
She says her long-haul symptoms have cleared up, but still plague many others.
This is our shadow pandemic.
Survivor Corps is advocating for more research on long COVID. That's as many questions remain about long-lasting symptoms, including their cause, whether the Delta variant will change the game, and if they'll show up in vaccinated people with breakthrough cases.
If it's going to happen, I think it's probably still too early.
Dr. Safdar says it's not too late to prevent long-haul symptoms by preventing COVID in the first place,
which was where the vaccine comes in.
She calls the vaccine a known entity, while so much about the virus is still unknown.
And we're still discovering new things that we didn't know before about the disease. So there's likely to be more things that we'll find out about long COVID.
Dr. Safdar recommends those who do have long COVID symptoms to keep track of them and seek medical care. There are some indications that vaccines may help with these symptoms. That's something Safdar says will need to be studied further.